Hello, welcome to the first of our Language of Anatomy videos, Video 1, the Anatomical Position and Directional Terms. In this PowerPoint, we will describe the position of the body in the anatomical position, describe the position of the body when the body is in the prone position, describe the position of the body when the body is in the supine position, and use directional terms to describe the position of a human body structure relative to another human body structure. The first slide shows you a picture of a woman standing in the anatomical position. In the anatomical position, a person must be standing up straight. Their feet must be close together, but not touching, with toes pointed forwards. In the anatomical position, the arms must be at the person's sides with the palms facing forwards, not with your palms facing your thighs, kind of in the natural position. Put your palms facing forward, like you see the woman in the image here doing. Okay, notice the laser pointer and the position of her hands. Individuals can be described as either prone or supine when they're in the lying down position. If a person is described as supine, they'll be lying down on their back, face up, typically in the anatomical position. If a person is described as prone, that person will be lying face down, typically in the anatomical position. Right. It is important to have the anatomical position as a reference because if you're going to discuss, say, some anatomical feature, you have to have a common reference point with the person that you're discussing it with. Imagine if you're trying to talk to a physician in Miami when you're in Los Angeles over the phone and you're describing this patient. You think this patient is lying face up in the supine position, and the person you're talking to is imagining this patient in the seated position. You have to have a common reference point to be able to discuss important features. When you're describing structures in the human body, it is common to use a set of directional terms that you can see laid out for you here. So superior or cranial, inferior or caudal, anterior or ventral, posterior or dorsal, medial and lateral, superficial and deep, ipsilateral and contralateral. The first of these directional terms is superior and inferior. Superior describes a structure that is either at the top of the body or closer to the top of the body than some other structure. One of the older terms that's sort of used interchangeably for superior is cranial. Cranial technically means at the head or closer to the head. So since we're standing up on two legs, superior and cranial will mean the same thing. This is not necessarily true if you're an organism that walks on all fours. Okay. So an example for superior would be the nose. The nose would be described as superior to the mouth. Okay. Next is inferior. Inferior means at the bottom or closer to the bottom. It is also common in older texts and things like that to hear people use caudal instead of inferior. Caudal. Caudal is sometimes used interchangeably with inferior. Caudal means closer to the tail or your tailbone. So an example of something that would be inferior is the chin to the mouth. You can describe the position of the chin as being inferior to the mouth because it's below the mouth, closer to the bottom or closer to your tail if you want to use caudal. Okay, our next set of directional terms are anterior and posterior. Just like we saw before, anterior and posterior have some other terms that are used interchangeably. Anterior means front or closer to the front. The term that can be used interchangeably with anterior is ventral. Ventral technically means the belly or closer to the belly. Ventral can only be used interchangeably with anterior if you walk on two legs. Because we walk on two legs, our belly is anterior. However, if you were an animal or organism that walked on four legs, like a cat, for example, recognize that your belly would be facing the floor. It would not be facing the front. So in four-legged animals, ventral and anterior are not interchangeable. But in two-legged animals like ourselves, these are interchangeable. An example for anterior would be to look at your shin in your lower leg and the calf in your lower leg. So remember, the shin is here and the calf is back here. So the shin, the front of your lower leg, would be anterior to the calf, which is the back of your lower leg. The opposite of anterior is posterior. Posterior means back or closer to the back. Dorsal can also be used interchangeably with posterior because dorsal means spine or closer to the spine. Again, the same rule applies as for ventral. Dorsal only works interchangeably for posterior if you walk on two legs. If you walk on four legs, dorsal actually points upward and is not necessarily the same as posterior. Again, think of your cat. The cat's posterior is the cat's tail, not the cat's spine. For posterior, an example would be the upper leg. So if you look at the upper leg, the muscles here in the front of the upper leg, people call the quads or the quadriceps. The muscles here in the back of the upper leg, people call the hamstrings. So the hamstrings are posterior to the quads. That would be an example I would use. The next set of directional terms are medial and lateral. Now, to understand medial and lateral, you have to use a reference. A reference, basically, that would be a line an imaginary line that you would draw down the middle of the body. This would be what we call midline, and I drew it in red on the screen here. So a structure that is medial is a structure that would be closer to this midline than some other structure. So take the nose, for example. The nose is right on midline. So you can describe the nose as being medial to the eyes because the nose is closer, literally right on midline, closer to that midline than your eyes are. The opposite of medial is lateral. Lateral means further away from that midline. An example of lateral would be again, the eyes, and then this time the ears. The ears are actually lateral to the eyes because your ears would be further from that midline than your eyes are. The next set of directional terms are proximal and distal. Now, there's a special rule for using proximal and distal. Proximal and distal are only going to be used for limbs, like arms and legs, and tubes, like the digestive tube or blood vessels. So proximal and distal are used for limbs and tubes because these are things that have a beginning and an end. So proximal means closer to the attachment or closer to the beginning. So if you're describing a limb, the beginning of the limb is the attachment point. So you would use proximal when you describe something that's closer to the attachment. If you're using a tube, you would say closer to the beginning. So an example for proximal would be to look at the elbow and the wrist. The elbow is proximal to the wrist because your arm attaches to your body at the shoulder. The elbow is closer to that attachment point than the wrist is. So the elbow is proximal. Distal means further from the attachment point or further from the beginning. When you're dealing with limbs, you could say that the elbow is distal to the shoulder because the elbow is further from the attachment point, which is the shoulder, than the shoulder is. Now, if I were to describe examples of tubes, you have to kind of remember that your digestive tract is essentially a tube that goes from mouth to anus. So if the mouth is the beginning of that tube, and then next you would go from the mouth to the back of your throat, which is called the pharynx. And from the pharynx you would go into the esophagus, and from the esophagus you would go to the stomach. From the stomach you would go to the small intestine. From the small intestine you would go to the large intestine. And then you would go from the large intestine to the rectum and then to the anus. So if you follow that as your digestive tube, you could say that the mouth is proximal to the esophagus because the mouth is closer to the beginning of that tube than the esophagus is. Using that same tube, you could say the stomach is distal to the esophagus because the stomach is further from the beginning of that tube than the esophagus is. So proximal and distal are special. They're for limbs and tubes. Next set of directional terms are superficial and deep. Superficial means closer to the body's surface, and deep means further from the body's surface. So your most superficial organ, of course, is going to be your skin, right? Because your skin is essentially the surface of the body. So we could use skin in our first example. Skin is superficial to muscle, right? Because skin would be closer to the surface than your muscle would be. A good way to think of superficial and deep would be to think of what structures a pin would pass through as it pierces the surface of your body. So if it will pierce your skin first and then your muscle, skin is superficial. In most cases, particularly on your limbs, an example we could use for deep would be bone. Bone is deep to muscle, right? If you were to pierce far enough with that pin, you pierce through the muscle and you would hit the bone, okay? Because the bone is further from the surface than, or excuse me, the bone is further from the surface than the muscle is. The final set of directional terms are ipsilateral and contralateral. Ipsilateral refers to two or more structures that are on the same side of the body. So an example would be the right wrist and the right elbow. The right wrist and the right elbow are ipsilateral to each other because they are on the same side of the body. The second term here is contralateral. Contralateral means two or more structures that are on the opposite side of the body. So the right wrist and the left wrist are contralateral to each other. The previous slide has no recording because it's just a table from your textbook. It would be nice for you to go over those that table in the previous slide to see some additional examples of the directional terms. But I have some directional term practice questions here for you in the final slide. So let's go over them. The first one, the nose is blank to the ear. So if you said that the nose is medial to the ear, that would probably be the best answer. Though you could probably also say that the nose would be anterior to the ear. But if it were me, I would pick medial. Your knuckles are blank to the wrist. So if you said that your knuckles are distal to the wrist, that would be the most correct answer. No matter what the position of your arm, proximal and distal is usually the best term to describe structures on limbs and tubes. Okay, so the knuckles are further from the attachment point than your wrist is, so then your knuckles are distal, whether you're in the anatomical position or not. They're always distal. Next, the chest is blank to the abdomen. So when you think of abdomen, think of where your belly button is. So your chest is blank to the abdomen. If you guess that the chest is superior to the abdomen, then you'd be correct. The chest would be superior to the abdomen. Next is the liver is blank to the skin. If you guessed that the liver is deep to the skin, you would be correct. Since the liver is an internal organ, basically all of your internal organs will be deep to the skin, since the skin is the most superficial organ. Finally, the shoulder blade is blank to the chest. If you guessed that the shoulder blade is posterior to the chest, you would be correct, because your shoulder blades are on your back or on the back of your body, whereas your chest is in the front.